Echo's Box podcast is not meant to be or claiming to be a good place for therapeutic advice. The host is not a licensed therapist and is not offering any services or advice related to mental health in a professional manner. The content discussed on Echo's Box is commonly highly explicit due to the real nature of expressing honest emotions. While we don't mean to offend anyone, the reality is these discussions might be triggering to many people. Out of respect for all, please do not listen if this content isn't right for you, and forgive us if you have a poor experience. Keep your brain healthy.
Human takes the point of view that if there is this deplorable something, the universe is one hell of a mess. And the only response that you can make to it is to move
Hey everyone, welcome back to Echo's Box. You were just listening to a sneak peek of the last song that you heard in the last episode, only now it's slightly more evolved and I'm not quite done with it yet, but we're almost there. I think I have everything written. I just need to stop being lazy and finish recording it. Anyway, on to today's episode. This is episode 36, Crisis in Addiction, featuring our lovely guest, Dr. Brian Licuanan. Let's get into it. All right, everyone. Welcome back to Echo's Box. Today, we're opening up the episode a little bit differently. I'm your usual host, still Casey. But if you're on YouTube, as you can see, well, you can see. This is our first ever real formalized video episode. And with it, we have a special guest today. His name is Dr. Brian Licuanan. And Dr. Brian is a psychologist. He has an award-winning book out called How to Get Your Resisting Loved One into Treatment. And this is something that, if you're a longtime listener to the podcast, you'll know I have a personal relationship to through my family and their struggles with addiction. And so when Dr. Brian's team kind of came to me with this, I really liked what I found in Dr. Brian's book. I thought a lot of things really resonated with me. And with that comes a laundry list of questions that I have to interrogate Dr. Brian with today. But before I start interrogating you, Dr. Brian, please introduce yourself for us. This is our first time kind of having a meeting here. Tell us a little bit about yourself.
Yeah, thanks, Casey. Good to be here, and I'm glad that you had found some helpful information and knowledge in my book, and I look forward to discussing that more and hopefully impart you with some knowledge as well as to your listeners as well. So, yeah, I am a licensed psychologist. I have my PhD. I practice out of California. Currently, I am 100% telehealth. I'm contracted with various entities, including hospitals, community centers, outpatient clinics, seeing clients across California. Also in private practice, I do have a specialization in insomnia. I work a lot with substance use disorder. I worked in a recovery treatment facility, residential facility for almost 15 years. And I also, in my private practice, a lot of the work that I do now, based on my book, is helping families strategize to get their loved one who's resisting any type of help to a point where they accept help and in some cases get into some type of treatment. And then of course, media appearances and spreading mental health knowledge is my really true passion. And with that, I'm a part of an organization, the National Alliance of Mental Illness, for almost 15 years, facilitate a family support group for them and part of their knowledge forum that we have. And I also just jumped on board with PALS, which stands for Parents of Addicted Loved Ones, and also in various capacities and articles and maybe some knowledge forums as well. So that's essentially what I do. And podcasts have been a really, really positive way for me to get that message out there.
Awesome. Yeah, I'm excited to have you. I wish you were around when I was first seeking therapy treatment. Not a lot of people have come as far as what I've seen from your research, really understanding the concepts that you specialize in, especially like I couldn't, insomnia could be a whole other episode. That's something that I personally deal with, but addiction, as a matter of fact, the way you just go about it through your book really clears things up for people who don't know what addiction even feels like. There's a lot of really good explanations that you have. But before we dive into some of those, I want to start just at the very beginning of your book. Right on page 2, you come out and you say, the first thing that I tell families is there's always hope. Without hope, the fight is already lost. And so right after that, you kind of immediately state how getting healthier kind of requires work. It takes a lot of emotional and mental toll on people. And you have several example cases throughout the book kind of demonstrating what hope looks like. But just in a general sense, how do people experiencing addiction with their loved ones maintain hope? What does that look like?
Yeah, and thank you for mentioning that. And it is my number one must know knowledge is because a lot of the families that I work with. And so this book was originally designed, at least the perspective that I approached it was there's a lot of families out there who feel desperate. They feel helpless. They feel like they've tried everything and they feel hopeless. They don't really believe that change can happen. And given my work with a litany of people coming to recovery, all kinds of different family dynamics, all kinds of mental health acuities and substances of abuse. I've seen some really, really dire cases, some really down and out cases. And through the process of working with families, their loved ones are able to get help, and the families are able to actually be closer than they were prior to this whole process. And so, what I say to a lot of these family members is have hope because there is still things you can do. It's just that you have to change the strategies. What you've been doing probably hasn't been working, and you can still come from a loving place, an assertive place with assertive boundaries. It's just that we need to revisit and revise the strategies to which you've been approaching. And that model is not just for recovery, that model is for anything in our life. If you're trying to improve as an athlete and just you aren't breaking that barrier, probably even though you work hard at it, it takes more than willpower. Maybe you're doing something not right. If you're trying to maybe gain weight or lose weight and you just hit a plateau, hard work isn't only the solution. Maybe you have to look at the strategies. And so that's why I tell a lot of families because, like I said, I've worked with really, really some dire cases, and people are able to get better, get help, and get on a healthy path.
Yeah, and like you said, it applies to so many things because hope is such a hard construct to really nail down. But I think when you experience hope, at least in my perspective, when I go through the treatment process that I've gone through with my mental health issues, hope always comes in the form of being able to look at the progress I'm making, doing the things that
Hmm.
evolved that didn't work. Like if something's not working, you do something that does work, and when you can point at
Hmm.
that and be like, "Hey, that's evidence that something's working. Let's keep going down those paths." That gives hope. So
Hmm.
think you highlight that really really well.
Thank you. Yeah. And then there's a concept too, is just because you're doing a lot of work doesn't mean you're getting a lot of work done. And those aren't my own words. At least Denzel Washington, the actor, mentioned that in one of his commencement speeches. And I'm not sure if that are his words or he got that from somewhere else. And that's very true. Is just because we feel like we're doing a lot, and I get a lot of families, well, we do so much. We try to talk to them. We do all these things. We do so much literature reading. We do all these things. We express to them how much we care. And those are all good stuff in a way. It's just that we sometimes correlate that just because you're doing a lot doesn't mean you're getting a lot done. And sometimes we fall into that trap. And sometimes a little bit of a switch of here of the strategy can make a world of difference.
It's quality of the work, not how much you do.
Mhm. Exactly.
Awesome. Well, this next one I'm going to go on a little bit of a tangent, so bear with me. I'll get to the
Okay.
question. But you talk about this some on page 2, but you really go into detail on it in chapter 6, and it's the concept of abstinence versus harm reduction.
Mhm.
And I loved your take on this because this is something that I don't think a lot of like people in familial situations, or really people that just don't have firsthand, they are not the addict, they don't have that experience with addiction. I don't think they really understand the difference between harm reduction and abstinence. And that's just maybe it's a little bit biased from my own personal experience, but um, the fact is that there are a lot of physical and psychological symptoms, and you talk about this, where sometimes you can't just cold turkey stop a substance. Like sometimes that will actually kill you, and that is the worst thing you could possibly
Sure.
do. It just depends on the substance, it depends on the situation, and there's a lot of variety there. And for me, there's a little bit of survivor's guilt tied into this personally, but my father died and he was an addict. He died right around when I was 18. And one of the things I struggled with certain family members, certainly not all of them, were them kind of painting him after he died as a druggie, or even when I was a kid and I didn't understand, they kind of painted him as a druggie. And all I saw as his son growing up was he went to recovery, even though I didn't understood what that mean at the time. He always was collecting those recovery coins, and he would show them to me. And he made
Mhm.
it a point, even when I was a 10-year-old boy, to be like, hey, this is important. I know you may not understand what this means, but I want you to know this is important. I'm doing this because I care, and I want you to like
Yeah.
treasure these things. You know, anytime you got a new coin, to be so proud to show it to me and show the progress, even when I didn't understand. And now that I'm me now, and I've gone through what I've gone through, like I just think, oh well, what a great world I live in now, where I could help him potentially have gotten like a medical card for marijuana to wean off pills and kind of
Mm-hmm.
do those harm restriction. I could be smoking weed on the back porch with my
Yeah.
dad, throwing ball with the dog, and he would be here.
Yeah.
And obviously that's painting a 2020 picture that also isn't reality. I don't live there, but what what that means to me in my experience with the family members who didn't have that perspective of harm reduction is basically they painted pure soberness is the only means of health. And when I think of people who aren't addicts, um, a lot of people in their daily lives aren't sober. A lot of people drink, they smoke, and they're perfectly healthy in terms of not having addiction. They may have other issues, but in terms
Mm-hmm.
of addiction, they can do that, and they're not sober. It's more about what is actually healthy for that individual. And obviously, I think getting to abstinence would be the goal for an addict if that's possible. But like you say in your book, and this is the most important thing, it's up for the physician to decide. It's up for the doctor to decide what is healthiest for that
Yeah.
person. And I think being more open to harm reduction ideas is something that's very important to me. So I wanted you to kind of expound on your own personal practice with that and how that relates to what I've talked about in terms of what you've written.
Yeah, very good. And thank you for highlighting that, is because a lot of people don't realize that that is an option out there. And with this whole recovery process, that there are lots of variations. What one work with one person may not work with another person. And so one thing that's very important that I like to communicate is there are different models out there. And however, what I look at, and there are in the work that I've done over the years, working in recovery and so forth, is that there are certain attributes that are critically important, like something like honesty. No matter what modality you do or engage in, being honest with yourself and others is critically important because we harbor secrets, and these secrets a lot of times turn into resentments. So there's attributes like that, but the path is never a single path. And so that's I'm glad you bring that up. And there's a couple terms. That's what I do a lot in my book, is because a lot of terminologies are out there and they're well-meaning. It's just that sometimes people understand them differently. And concepts like tough love, enabling, those are all coming from a place of love. It's just that sometimes if a person interprets it in a different way, it becomes more problematic than actually facilitating healthy change. So a couple concepts that I'd like to talk about are: number one, sobriety. I also want to talk about abstinence, and I also want to talk about harm reduction. And so let me start off with abstinence. So abstinence is, when pertaining to a substance, is just not engaging in a substance. That's it, right? We can use terminology similar to that, is white knuckling it or being dry. And so just pure abstinence is that I'm just not engaging in the substance any longer. It's just that I'm not working on other areas of my life, whether it be my physical self. I'm not taking care of my body. I'm not working on my mental or emotional self. I'm not talking about things. I'm not looking at stress management, emotional regulation. And social health could be your relationships. I'm not working on improving my relationships with people. And then spiritual part. And spiritual is not just a higher power, it can be. Spirituality is just having purpose and value. And so that's usually someone who's just dry or abstinent, is that it's just, I'm not using. Sobriety to me is an overall comprehensive angle of recovery. It's not only am I not engaging in the substance, but I'm working on all of those areas of my life: the physical, mental, social, and spiritual. And so I do believe, and I've met a lot of people, there's a difference in energy and outlook and speech and everything else about someone who is abstinent versus someone who is sober. And so maybe you've seen that before and see the difference in that. But of course, the real comprehensive way is sobriety, if that's what you're looking for, if abstinence from a substance is important. But another one, the third one, is harm reduction. So harm reduction is an alternative means of working on recovery or heading out on a healthier path. And harm reduction means that we're not going to be completely abstinent, but we are going to tailor or revise um, that to reduce the level of harm. For example, if someone is drinking a bottle of vodka every night, maybe engaging in a six pack of beer is something that they're going to work towards. Maybe if someone was engaging in heroin, that maybe smoking THC is an option, right? If someone as was engaging in um, um, cocaine or meth, maybe caffeine or smoking cigarettes is an option. And we see that other ways. You know, they actually pass out syringes. I know it seems so for some people very, very counterintuitive that, but people are passing out clean syringes because if they're going to engage in drug use, they'd rather it not be sharing needles. Also, you know, people have different ideas about this, about people passing out condoms for people to prevent spread of disease or if their goal is to not get pregnant. And so those are all forms of harm reduction. Um, the population that I work with or worked with in the drive behind the book where harm reduction typically isn't the optimal option for them is because these people have tried it and they are at a level of acuity or crisis that they've tried all those things, and sobriety and abstinence is the most appropriate path for them. But I wanted to introduce that because a lot of people have that idea that it's either you get abstinent or nothing. And there are other options, but ideally, the goal is if someone's had a long history of a substance use or a family history, complete abstinence in terms of in leading to sobriety is probably what I would work towards if someone's truly working on lowering their risk factor and a complete overall um, healthy, productive recovery.
Yeah, and I think one of the things that uh, I've personally experienced, and I think maybe rings true when people hear about the concept of harm reduction, sometimes it may be taken as, oh, well, that's just an excuse so they can keep using. Just maybe it's something different, and it's not that at all. And like you described, in terms of a crisis situation where there is like that, harm reduction is not going to be something that is the ultimate goal. The ultimate goal is abstinence. It's yeah. In that vein, I understand why people might be upset at this idea and why they may paint notions of, oh, it's an excuse. But that's why I really enjoyed your breakdown of this, because even though the focus is these crisis scenarios where ultimately we do need to get to that person to a point of abstinence to be fully recovered in a sense. Um, it's still an important option that's out there, and addiction looks different for everybody. And I thought you just did an awesome job explaining that. And like I said, that was something that resonated with me. But um, kind of leaning into that, this crisis situation, um, you talk a lot about the kind of social dynamics. I've been talking about like a lot of my interactions with family and stuff like that. How do social interactions play with family members? You have this whole whole series of steps throughout your book where you're talking about different ways to maybe evolve the communication when people are handling their loved ones who have addiction. And it's hard because in crisis situations people get emotional, and it's for good reason. It makes sense. They have every right to feel the way they feel, but sometimes that turns into not so great
Mhm.
communication, which isn't helpful. And I think
Yeah.
one of the main goals of your book is to help improve that. And so could you kind of
Mhm.
like educate me a little bit on some better ways
Yeah,
to communicate?
sure. Yeah, and that's a huge part of it is how we communicate is critically important because that's the difference between, for example, someone trusting you or building rapport to someone not. And a lot of times we communicate even coming from a good place uh, isn't always the most effective way. And one of the things that I do mention is just because you come from a good place doesn't always mean it's the best or the right place. And you have a lot of these well-meaning family members, and I've worked with a lot of different family dynamics and toxic family dynamics. And whenever I give statistics, they're just my own statistics. They're not anything that you can just Google and there it is, a hard, fast statistics. But one of the things I say, at least in the recovery arena, when I've worked with people coming to treatment, I say 99% of those family members meant well. They really did. But sometimes just because they were coming from that place wasn't the most effective. For example, I had a client that you might have recalled in the book where they had an only child, and the parents grew up in an era of the 60s and 70s where they smoked a lot of marijuana, THC. That was just part of their culture and lifestyle. And when their child was about preteen, teen years, their child was starting to express a desire to smoke marijuana. And so the parents had said, well, if she's going to start smoking marijuana, we might as well teach her the appropriate way to smoke marijuana. And so they smoked out with her. And so she ended up becoming addicted to that along with alcohol and other substances, and they harbored a great deal of guilt. They said, "Oh, Dr. Brian, we're the reason why she's an addict." I said, "Well, number one, did you mean harm? Did you mean for her to become addicted? No. Then you have to let that go and release yourself from guilt. Was it probably the right choice? Probably not the best choice." And that's one of the things that a lot of families stay stuck is that they harbor a great deal of guilt or fear. But the relationship and the dynamics is critically important. And one of the things we do is you can still come from a loving place. It's just that we have to be very clear on our boundaries. For example, the language that I use if a family member is trying to help a resisting loved one is, hey, we're here for you. We're always going to be here for you. It's just that we can no longer support this lifestyle. And when you're ready to get help, we will be here for you. Because what happens is now the choice is up to that person. Whenever we say someone that they can't drink, they can never do this or do that, as a human condition, I truly believe we resist that. And so to take out that power struggle, we give them that option that, hey, this is a lifestyle that we're not willing to support, but this is the lifestyle we're willing to support. And so that really helps a lot of family members who harbor a lot of guilt. They say, like, well, God, you're telling us we're kicking out our daughter out of the house. I said, no, you're telling your daughter that she's more than welcome to stay here if she's going to stay sober and absent and get some help. But if she's not, she can no longer stay here. And so that takes out a lot of that power struggle that I find, and it really helps ease that. But yes, communication, the little twist, the little intricate parts of communication can make a huge difference, just like that one as well. And when you kind of revise the way we communicate, it can really, really make a big difference.
I think kind of like what I like about that is it really does set proper boundaries, which I think is just something healthy to do in
Mhm.
general. But I think it may be difficult for some people to, uh, or not really for the family so much as the addict themselves to really not feel like they're getting kicked out. And I think that's where it comes to a point where the family has to realize, hey, it's not an ultimatum. These are just boundaries of what I'm willing to accept under my own domicile to feel safe, or what in that
Mhm.
particular example. And I think they're reasonable. And I think maybe an addict who's not in the proper state of mind would see that as reasonable. And that's where like that choice of they have to choose to get the help. And once they
Mhm.
realize they want that, then it doesn't feel like an ultimatum anymore. It feels like, oh, I'm actually just respecting somebody else's boundaries. I think that can
Mhm.
be kind of hard, but I do think it's important. Do you have any kind of advice for people who may be struggling with addiction themselves, or for family members who are kind of going through that boundary setting struggle, on how different ways to kind of ease into a boundary? Maybe I'm not sure what the best approach is. It just seems kind of like maybe setting a hard boundary can be kind of abrupt and jarring.
Yeah, it can. It can. It all depends on the situation. But if I do write about it in one of the chapters in terms of actually a three-pronged process of setting that boundary. And of course, whenever we want to set a boundary, it comes from a very collaborative and loving place. For example, you would say to your loved one, "Hey, we were concerned about you. We noticed that you're having some struggles. We'd really like to help support you. Please, work with us and let's get you the help you need." So usually that's a general way of approaching it. And the second tier is, hey, we're really, we've talked to you before about this, and we're really concerned. The actions you're engaging in, we're concerned about your health and now also our health. And we're really looking that by this date, we'd really want you to come to us and tell us what a plan may be. And then the third place, but we've talked about this before, and this is something that we need to make a decision and really do what's best for not only you, but for us as well. And I think one of the biggest things for family members to notice, or I help families communicate, is number one, is that their actions are now affecting us as a family unit, and what we've been doing is no longer working. right? We've tried to help you. We've done what we can. It's just that now it's impacting not only yourself, but us. And what we've been doing hasn't been working. We're on our own recovery process as well. And we have to be mindful and to look out for everyone. And we need everyone to do their part, including themselves. And you've probably, if you recall, in my book too, is some of the best places that anyone's ever had to go. Very fearful as a parent, where people do get help, is they end up in situations where they have to make a decision and they're at desperation, whether it be homelessness, whether it be in a hospital, whether it be in jail. That's not what we ever would want or push for. Absolutely not. That's just one of the places where it provides you what I call leverage. And I believe most people, there are people that can do it, but there are outliers. But most people can't. I do, at least when I've worked with true homelessness. I'm talking on homelessness isn't have a tent in a car and you go or couch surf in friend's house. I'm talking about true homelessness. I'm talking about dumpster diving, sleeping under the freeway, sleeping on park benches. I find most people can't do that. When family members hold that boundary, they're like, okay, fine, this is I don't want to do this anymore. I'll do whatever it takes and just get me off these streets. People can't do true jail or homelessness, and it's an option. Or people in behavioral unit. I've literally had people who go to a psych unit say that's worse than jail. And so it's not that we want to put them in these places, but sometimes we put them in a place where now they're forced to make an option. And just to let you know as well, research shows that people who are forced into getting help can be just successful as people who are truly motivated. Of course, people who are truly motivated helps, but what happens is a window of recovery and health that people have to go through. I call it like between 30 and 90 days, where all of a sudden they start having a change of perspective. I've literally seen people who want to die or want to kill someone or only want to use and believe no one loves them anymore. But as they get healthy, they sleep better, eat better, connect with people in therapy, and when appropriate, take medications. Wow, I love life. I don't want to die. I know there's a family that loves me. It's just we have to get them in that window of opportunity to start healing and thinking different and provide them new experiences.
Would that be kind of like just the concept of hitting rock bottom, so to speak, and that's kind of what forces you to the other side? And I ask that kind of because uh, it's not only motivation, and obviously you don't ever want anybody to have to experience that, but like you said, it happens. And when that turns into kind of they're forced with no other options, and that be, I can
Exactly.
see why that'd be as successful. It's just interesting because that's like the colloquial, and it seems kind of stupid maybe, but I never really think about terms like rock bottom and what that means in the context of reality. Like, is hitting rock bottom being homeless? Is it going to the psych ward? And it sounds like, yeah, yeah, that's what it kind of looks like.
And I'm glad you bring that up too, Casey, is I do talk about rock bottom as well. And that is a popular term out there. And, there are different variations. Rock bottom means you can no longer dig, or rock bottom means everything, things like that, or just a complete place. But I like to say a point of desperation, because I believe there's some people out there who are homeless, who are suffering from a mental health condition, or some type of substance addiction, that they don't know what rock bottom is for them. There comes a point where the reality has been so impacted and that they don't really know what rock bottom means. However, I like to say put a person in a point of desperation, right? Whenever we're in a point of desperation, which I believe, we all have on some level, we'll do anything to relieve us of that pain. And obviously, that's not going to hopefully be something of like harming yourself or harming someone else. But we'll take that. That's what we need to do. And sometimes family members coming from a good place. If you recall, I talk about emptying at the gas tank, is it doesn't take much to fill up someone's gas tank. What metaphorically, what I mean by that is sometimes someone's homeless, for example, since we're talking about that. Oh, well, I'm not doing much. We're setting some boundaries. And I talk about it. Well, we see him once a week and we give him a motel room just once a week, or we provide that person $10, just that's it, just twice a week. But they don't realize that that's putting a little bit of gas in their tank to keep surviving. And number one, what it also is doing is it's creating this connection that, oh wow, I could still be homeless and I'm still getting that support. That's at least the way they're seeing it. But like I said, when people are in a put of desperation, it they a lot of times will make a choice to relieve themselves, and that's what you want to do is they surrender. Okay, I don't want to live this life anymore. I'm done. And that's some two of the best words that someone can do when they want to make a change is these words of I'm done. Not done living, but just done living this lifestyle because it
Mm.
is an exhausting lifestyle. Finding that next high, hiding, going to work under the influence and presenting this facade, it's an exhausting life. And when people get a snippet of what a healthy life can look like, it's like, wow, this life is so much better. It's so much easier. I don't have to hustle. I don't have to do this. It's so much better being honest. It's so much better being authentic. And so that's where that comes from, that rock bottom versus a point of desperation. And you mentioned a very good point is we have to limit those options. And I don't know if you remember the analogy that a mouse can squeeze through a hole the size of a dime.
Mm.
And that's what we have to do with families is we have to limit every single opening there is. And sometimes with family dynamics, there is that one person that is that opening for that, and we have to shut all of that down. And so that's what I do is I give a family intervention, not with the loved one, not that type of intervention. It's the family unit I have to intervene on and say, hey, we need to create this unified vision and make sure that we're going to follow through with it.
Kind of going back to towards the beginning of the book. Apologies, that is the start of the show. Echo himself, having a
Oh,
ball.
echoes.
Would you like to come say hello, Echo? Come on. If you don't come in, I'm gonna have to edit it out.
Oh,
There he is.
hi,
Good boy.
Echo. Oh, beautiful dog.
Good boy. He's the whole reason we do this. But kind of back to what we were talking about. Towards the beginning of the book is where I wanted to go. Where you have to define what addiction is, right? And
Mhm.
a lot of people, I think nowadays are more familiar with mental health issues as a disease in general. It's not necessarily just addiction. It's a lot of things we could classify with this term disease, but we still don't really understand what that means. And you do a really good job, I think, really defining what a disease is and how that term could relate to
Yeah,
addiction. So could you kind of give us a little bit more about this idea, kind of expound on it
yeah,
like you
yeah.
do in the book?
That's a very, very popular question. I'm glad you bring that up, and it's a dialogue I have with a lot of family members. And so one of the amazing realities is that there is no unifying definition in the mental health or the medical arena of a disease, right? The World Health Organization defines it differently. The American Medical Association defines it differently. The American Psychological Association defines it differently. And so it really is, there's no unifying definition, and there's actually arguments on what is the correct definition or not. But we do know, right, there are medical diseases out there, whether it be hypertension, diabetes, autoimmune disorder, right? And then there's mental health diseases. There's depression, anxiety, post-traumatic stress, alcoholism, substance use issues. And so I think a more consistent definition is this entity that has these symptoms that cause impairment. And so I like to take it to a broader level is a disease is any entity. It could be a person, place, situation, or thing that's been chronic, meaning it's been long lasting in our life, and it causes impairment in one or more areas of our life. And so in that sense, um, we all have some form of a disease. In the some of the 12-step recovery arena, people have said that they define dis-ease as being not at ease. I don't know if that's an actual definition, but it's a great play of a deconstruction of that
This is a
word,
great play on words, yeah.
dis-ease. Yeah. And so that means we all have some form of a disease because every single one of us have some entity that we struggle to resolve or work through or manage, and it's caused impairment in our life. And so not only is it a medical condition or a psychiatric condition, but it could be things like materialism, right?
Mm.
There's no medical definition of that, but if it causes impairment in your life and it's hard to work through, that's your disease. If selfishness is your disease, right? And if it causes impairment in your life and it's something you struggle with, then that's your disease. And hedonism, and we can go there. Um, seeking pleasure. And so we all have our version of disease, and I believe we're all in some form of recovery. A lot of
Mm.
times people think recovery is specific to a medical issue, like, oh, you had a stroke or a psychiatric condition. Oh, well, wow, what substance are you recovering from? But yes, those pertain to that, but recovery just means a healthier plan in place for better living or outcomes. And so we're all, given we all have a form of a disease or diseases, we're all some form of recovery. And I believe recovery, a healthy, strong recovery, is the basis, the critical, most important thing in our life. Because without a strong recovery, it's very hard for us to be who we want to be, whether it be a spouse, a parent, an employee, a career person, a romantic partner, a friend. And it's because of what the attributes I believe constitute a strong recovery. Like I said earlier, things like being honest, being open to direction, healthy fellowship, healthy thinking, optimism, hopefulness, positivity, all those elements that constitutes a strong recovery. So,
Man, you heard it. We're all sick. But no, I mean, no, that kind of blows my mind a little bit because I've not really thought about it in those specific terms before kind of reading what you've written and hearing you
mhm.
explain it out loud is all just the more clarifying. It's like, man, yeah, we all do kind of struggle with something no matter, and even if you're not now, you will. I'm sorry. At some point, it's just
And like,
life.
it could be overworking, it could be
Yep.
underworking, it could be pessimism. It could be any one of those things, and so I think what that does is it helps validate and us to acknowledge and recognize that we're no different. A lot of times, we tend to can potentially categorize. Well, you have this alcohol problem, just like what you said with your father, and he's looked at this person, and we all struggle. It's just that his struggle is just dressed differently. It's just
Hmm.
in the form of a substance, but we all struggle, and we sometimes rank order ourselves. Well, we're a higher category to you because we never endured that, or I came from this type of background, or I didn't have that trauma. And no, we all have our form of challenge and difficulties. And I think when I look at things like that, it really, really helps us hopefully understand and acknowledge and validate other people. It just looks the struggle is just different.
So it kind of in the same realm of disease, when people think of it as like something that's like a hereditary thing, whether it's an actual physical illness or a mental health disorder, it's
Mhm.
this idea of predisposition. I'll kind of go on another tangent here for some context, but my family personally always used my dad's addiction even after he's passed, kind of like as a fire and brimstone biblical argument that I was most at risk for being addicted. So as a kid, it was always you could never drink, you could never smoke, you couldn't smoke weed, couldn't smoke cigarette, didn't matter. Never do that because we're worried that you're going to become an addict like your dad. And I thought, in hindsight, maybe that was just like a really strict parenting tactic and it pretty effective. I didn't do anything until I was about 18 years old and was an adult, which better for my brain overall because that, got to develop your brain before you start considering anything, and even 18 is not developed, right? But uh, to this day though, even after having gone through what I've gone through, and I've got 3 different doctors approving medicines in terms of medical marijuana and benzodiazepines for my treatment that's effective. They've clocked me as definitely not having any kind of addictive tendencies at all. In fact, my anxiety is far my higher risk than anything else that I could possibly have. But it is my understanding that while there is such a thing as being having some kind of potential genetic predisposition, it's not black and white. And
Mhm.
and from my experiences, while my family had a point, it's not that simple because just because you have a history of mental illness
Yeah,
doesn't mean you're going to get that
exactly.
specific mental illness. And I clearly
Exactly.
got my mom's anxiety and not my dad's addiction, right?
Yeah,
So
exactly.
that it was just kind of something that I really have a bad taste in my mouth when it comes to that. And I think it's very dangerous the way this idea was wielded in my life, and I've seen it in a lot of other people's too. So I just kind of wanted to get you to expand your thoughts on the social situations around approaching addiction as a disease. Like, how do you talk to people about that? You've kind of described what a disease is, but in the context of addiction, like, how
Yeah.
do you approach that socially?
Well, what you're referring to a lot of is something that I talk about as well. It's about risk factor versus the probability or risk factor. And so the way I relate to that, what we all can do is I talk about flattening the risk curve. And so, although I work in recovery and I work with people trying to get sober or healthy or harm reduction, what have you, is they're sometimes surprised when I tell them that I'm not against alcohol. I'm not against marijuana. I'm not against opiates. I'm not against certain substances, of course, more the illegal ones, definitely not in favor of. because there are some people out there who can engage in substances and not be a problem, right? Someone can have a glass of wine with their steak dinner and not be a problem. There's people who can take a regimen of painkillers in the form of opiates for a back surgery and not get addicted or transition to heroin. There's some people that can smoke marijuana, THC, for maybe recovery from cancer or to help with insomnia or help with anxiety and not become dependent or use an excessive amount of it. And so I'm not against those things. And so what I do tell people is that we have to be mindful if we fall under a certain risk factor, right? For example, if there's a strong family history of substance addiction, does that mean you will necessarily become an addict? No, but is there a certain risk factor? If you have a certain risk factor of other things, and that's relating to the medical model. If you have a family history of heart disease, your parents have heart disease, your grandparents have heart disease, your uncle has heart disease, you may have a potential of acquiring a heart disease. Does that mean you will? No. But does that mean that you have a risk factor? And so we have to be mindful of those things. And that's what I tell people. And I think that really helps with that discussion but I do believe a mind-altering substance, and anything's a mind-altering substance. The things like alcohol, caffeine, even cigarette, nicotine are all mind-altering substances, or in THC. And I do believe if you have, for example, an underlying mental health condition, a mind-altering substance can make you more sensitive to an underlying condition, bring about a condition sooner or later, or heighten or worsen or exacerbate any symptoms that you may be having. And so, because usually what happens, the risk factor is, especially if someone is not engaging in other alternative methods to seek relief, is will that would be the one thing because it works. If, for example, drinking a little alcohol takes the edge off, it works great initially, and then we start um, focusing on that one as the only tool, and we forget that there's things like mindfulness techniques, meditation, and other things, and working out in the gym, and yoga, meditation, Pilates, and that becomes our one thing, hence a dependence. And then what happens, of course, it's no longer about one glass of wine to take off the edge. Now it's two glasses. And so there becomes the tolerance and the counterproductive nature of it as time goes on. So that's how I approach that conversation. A lot of times when people say, because a lot of people say, "Oh, Dr. Brian, um, I don't. I think I can handle my alcohol. Whiskey was my issue. I think I can drink some beer, or I think I don't need to take my medication for my bipolar. I think I have enough tools." I don't argue with them. I just say, "Hey, I'm not here to argue with you. What I'm here to do is give you options and choices, and I give you a preview of what another life could look like, because that other life is waiting for you right outside the door. I just can't promise you those people in your life right now are going to support that lifestyle." And so that's another way to take that out. But I don't argue with someone, "Well, you are an addict because, well, you are this and that because that becomes very circular and it becomes a power struggle."
Mm. And one of the things that my therapist kind of she had to drill into me, bless her, was all of that trauma from being told that I was going to be an addict and all this kind of stuff. I was scared to take medicines when I was going
Yeah,
to treat
exactly.
my own mental health disorder. I was like, I don't know. And it was hilarious because I was self-medicating with other things at the time when I couldn't take it anymore.
Hmm.
But all that did to my therapist was say, yeah, you need relief. That's not the relief you need. No, what you're doing's not it. But you don't have a substance problem. You're dealing with these real mental health issues. Let's seek actual medicine. And I was like, I don't know. Even though I'm doing this dumb thing over here, I don't know about that. She had to drill that into me to get me to accept that.
Yeah,
And now it's a tool. And I love it. Like,
exactly.
yes, I have access to these substances that could be very bad for people who do struggle with addiction. And also, it's important to note that just because you have similar mental health issues that I do doesn't mean the same medicines that work for me will work for you. Marijuana
Exactly.
doesn't help everybody. Xanax doesn't help
Exactly.
everybody, but you work with your physician, I guess is the key point. And it's been hard for me to communicate to my family because, like I said, I'll mention smoking weed and I'll still get a couple looks from people. It's like, this is what I am supposed to be doing. And I hope one day, like you're saying, these are tools. I hope to not need the tools anymore.
Yeah,
That
exactly.
I'm not doing this to do this for the rest of my life. I don't want
Hmm.
to need this for the rest of my life. I just need it right now to help me. And
Hmm.
you move along. And I think that's something addicts can't do the same way. And I think that's a very important distinction. and the help you provide, like you're saying, so you can't. You're an adult. Anybody who's listening, if you go to therapy as an adult, you're an adult. You can make your own decisions. Your doctor's trying to help you. That's what you're paying for, right?
Yeah.
You go to get help, and so like you're saying, you're not going to force them, but the reality is going to hit pretty quickly that you need to not look at what you are thinking you're capable of, but more so what is healthiest for you. And that's why you should go and seek help. I didn't know what was healthiest for me. That's why I went and asked somebody who could help.
Yeah. If I could mention on that too, you mentioned a very important concept, what I call a barrier for someone to get help is because, again, your family members were coming from a good place, right? That, hey, what it creates is because a lot of it was based out of fear and
Mhm.
guilt. And so they were trying to come from a good place and protect you from that. It's what they don't realize, that at least what I'm observing from, is they create this walking on eggshells. You were like a walking time bomb. Like if you do this, therefore this is going to happen. And so you were living this idea in your head, that was the seed that was planted in your head, that anything to a point where if I even look at alcohol, then I'm going to drink it. Or, and you created a little bit of this sort of this anxiety, or maybe even a neuroticism of some sort, which is some type of anxiety and fearfulness and nervousness. And the big part of it, what it creates is a form of shame, this form
Mhm.
of humiliation, that if I do engage in that substance, I'm going to experience a great deal of shame. And shame is a really, really one of the top critical barriers to why people don't seek help or don't tell people that they're struggling, is because something had told them, whether it be rational or not, that this is very shameful what they're engaging in. And I'm assuming on some level, if that's kind of what you felt based on all these people telling you you can't do this, and anytime you smoke marijuana, you feel kind of ashamed with people looking at you a certain way. And so, um, what I would encourage family members to do that is give the person an option and choice, but educate them on the risk factors. But to do this, that A is definitely equal to B creates this level of fear and anxiety, guilt, and shame in the person, and they're more likely to disconnect from people and talking to people rather than moving towards them.
Absolutely. So I want to topic shift just a smidge, although
Sure.
you do talk about this towards the beginning of your book, but you practice jujitsu and you describe how it's not only been a great physical and mental health tool in your own personal fight, but before I get into your jujitsu stats, I kind of want to dive in a little bit more deeper to how you communicated uh, growth or a fight. Because when you describe a fight, when you're talking about jujitsu in your book, you describe how what sounds to me anyway like growth in the broader lens of light. Like you're not just describing yourself as fighting and training just to win a particular battle. You're describing yourself as pushing boundaries and be able to take
Mhm.
on more than what you thought you could. And you kind of hinted to this
Exactly.
earlier in the episode too. Um, and I think that just translates super well into being able to take on other things too, like growing in a way that you can take on more good things in your life
Mhm.
or taking on more rest if you want. Whatever growth looks like, as long as you don't mentally tap out, you keep going, you try to push the boundary.
Nice.
And that's kind of what I got out of that personally. But what would you kind of describe your mental journey in terms of jujitsu to look like?
Well, my mental journey for that, and thank you for bringing that up. And it's just whenever someone brings that up, it brings equal excitement, talking about jujitsu along with, of course, mental health and so forth, because I believe they're so intercorrelated. And jujitsu just fell into my lap because my daughter trained, and I was watching her one day, and I said, I think this would be something I would need to do. I was in a midlife time of life where I got my degree and everything, and I was looking into something new into my life. And I grew up with competitive athletics for most of my life, and I just, because of education and family, I was no longer engaging in a sport enough to compete, and I fell upon that. And actually, initially was to help bond with my daughter because she was also competing, and so I started competing as well. And it's something that I really, really became connected intimately with, and for a whole bunch of other reasons. But one of the biggest ones is how humbling it is. It is, I've been in a lot of different sports, and and sometimes excelled. But jujitsu is one of those sports where you can be humbled every single day, or every single person who you ever roll with. You could have smashed someone 5 minutes ago and get completely smashed. We call it the hammer or the nail. Are you the hammer or the nail? And today, um, Professor Nathan, I'm going to go a shout out to you from my school, but in Lancaster. And he's a black belt. And he really, really humbled me today and was also great in teaching me and helping me with some pointers and tips. And that's the best thing about it, because I do believe a lot of, if I could break down those people who continue to progress in life and don't, it's just how they think. And a lot of times we limit ourselves on our potential, and we don't realize how much more we have in our gas tank, or how much more we have in our potential. And a lot of it's limited from past experiences, or what people have told us, or based on fears. And jujitsu has been one of those things where not only it helps cognitively become solution focused, but it's the humbling part that is critically important, because it pushes you to another level. And it really increases what I believe that is that threshold of stress and discomfort.
Right on. Now, tell me about your jujitsu stats. I want to know your win-loss ratio. Maybe tell me about your
Lost weight.
favorite fight, the fight you
Oh,
maybe learned the
wow.
most from, or maybe your least favorite fight. Any or all.
Well, I have been competing. I've been training jujitsu for 6 years, and I've been competing as a white belt. And this year, these past 2 years has been my most active in competition. This year alone, in 2024, I competed 9 times in what the league is called the International Brazilian Jiu-Jitsu Federation. And I really pushed myself, and I had support of my wife. Actually, it was my Christmas gift, because we agreed to 6 competitions a year. And she said, for Christmas, I'm going to give you 9 to 10 competitions. And I did it.
Yeah.
And I was very humbled. I like to compete in my division, my weight division age, but I also like to enter in the open class, which is the same belt weight in age, but I'm sorry, it's the same age and belt, but open weight class. So it's any weight class. And I
Mm,
love doing that because that pushes me to my limits. But humbly speaking, I was able to, in this past 2 years in my belt, acquire highest number 2 ranking in the International Brazilian Jiu-Jitsu Federation. That's
very nice.
my world ranking, and so I was really proud and humbled about that, and it was really validating for me, because I believe I did put in the hard work. I did push myself, and I didn't always win, but I always would come back and push myself to greater limits each time. And so I've had a lot of great fights out there, and the biggest thing, and I think sometimes I enjoy it more than competing, is making friends. I've made so many friends across the world from other schools. Um, and you just meet so many people, and then the culture and the camaraderie is just nothing I've ever experienced before. Is that it's intense. People go out there and compete, but you see people after a match exchanging social medias and phone numbers and having lunches. And I communicate to this day with a lot of people from around the world, and it's been probably the most unifying culture, but yet one of the most difficult ones to compete in that I've ever experienced before.
Man, that's awesome. Hell yeah. I am particularly interested kind of more in the parallels of martial arts and mental health, just because for me personally, martial arts are popping up a lot more in my life lately. Very weird. So when you came along, that was even more emphasis, because I see my friends kind of getting into it more, whether it's boxing or MMA, or some of them have taken up interest in jujitsu themselves. But I also see profound figures of my life, like one of my spiritual teachers that I learn under does karate, and he does staff training within karate. And when he talks about karate, he constantly calls out the parallels between the tradition of the martial art and the traditions of the spiritual practice and what we're taught. Like even stuff as simple as breathing and how that relates to chi in karate versus energy flow and breathing techniques with meditation, and how those are just like pretty much the same thing. It's just in two different contexts. And I
Exactly.
think that is fascinating. I have not set aside my own personal time or really decided what kind of martial art I would want to do, but I find it very interesting, and I see myself teetering the edge. And now I'm seeing a doctor in the mental health space appeal to a
Mm.
martial art.
Yeah.
So, what sort of insights do you have, and would you recommend people generally to engage in a martial art if they're physically able to?
Yes. I think martial art is one of the biggest um, change factors that hits upon all levels of and it doesn't matter. I grew up and also competed in Taekwondo growing up, and it is of course things like discipline and nowadays emotional regulation. Actually, there's research that showed that young boys that are diagnosed with attention deficit hyperactivity disorder or deal with something of that nature greatly increase their ability to regulate emotions and sustain attention is because the martial art, I can speak specifically for jujitsu, it is probably one of the most mindfulness activities you can engage in. And mindfulness means staying present in the moment because you cannot focus on something else because if you do, then your opponent's going to be able to transition a move or finish a submission. So it really forces you to stay present in the very moment. And that's mindfulness techniques. That's the broad umbrella of that is because a lot of times anxiety very generally is worrying about the future. Depression is, concerned about the past, but staying present in the moment is very, very huge. And jujitsu provides that because, like I said, you cannot, for one instance, let your mind wander or make a mistake, is because the person will be able to advance or take advantage of that. And I believe that's for any martial art, whether it be karate, taekwondo, especially in the competitive level, is that there's a great deal of focus and things like that. But it definitely helps a lot of kids, at least and also coach. You see a lot of kids there with maybe autism, spectrum disorder, attention deficit, anxiety, and you just see them grow and change and be comfortable in their body. We have a lot of military people who were deployed, and they talk about how jujitsu has been the most emulated aspect since the military that represents that camaraderie. And so I think any martial art I would recommend it for anybody. It's great, the mind, body, and spirit, and confidence as well. So find out what's great for you. I can speak for jujitsu. I do believe it is for everyone. And I do believe it improved my health on all levels. And it's been probably the best shape I've ever been. And it's been literally a game changer for me.
Okay, so I gotta go figure out what martial art I want to do. More and more, I'm serious. I see it more and more. It feels like month after month, somebody new in my life or somebody that I know is like, okay, yeah, I'm doing this now. I'm like, okay,
Yep.
okay. It
Yep.
sounds like something I would actually enjoy, and I don't know what's keeping me from it, but I'll figure that out and I'll figure out what I like. But that's really inspiring, I guess is my point. I'm kind of
Thank you.
rambling, but um, yeah, I appreciate that. And we're kind of wrapping up here, but is there anything you'd like to ask me? As if you came prepared.
As
This
if you
is
came
your interview.
prepared. Well, let me ask you this, if I may, because
Sure.
and thank you, by the way. It sounds like you really dove into my book, and I'm not sure if you finished it, but you really dove into it. And if I may ask you, what was the biggest impression or message that you took from it that was the most impactful for you?
Honestly, the communication stuff, because that is so hard, and I experienced the wrong version of that firsthand. And so seeing the better way to do it helps maybe not resolve anything that I've gone through, but it does help me going forward that if I ever encounter somebody in my own life, be it children I have in the future or a friend that falls down a path, I feel more equipped just from the
Okay.
communication aspect alone is probably one of the biggest things I got out of it. And of course, my own agenda of the harm reduction thing was also something important to me because I'm on the flip side of that. And it was just very validating to say,
Mhm.
yes, please just trust your doctor. Quit pulling shit out of your ass, and these are valid methods. It's okay. Like quit
Yeah.
screaming at each other, basically,
Yeah.
in terms of family. So those are the two big sticking points for me.
Thank you very much. Thank you very much. I love the feedback, and whenever I hear someone say it's helpful, and that's one of the things I want it to be. I want it to be, like you said, like, hey, if I have kids, is I want it to be a timeless strategy guide. Is because that's why there's not a lot of statistics in there and dates and so forth, because I want it to be 50 years from now, because depression is pretty much going to look the same way 50 years from now. It probably looked the same 50 years ago. So is anxiety, post-traumatic stress disorder, substance use disorder. We may have different approaches and medications and treatments, but the disease still looks the same. And that's what I'm hoping, that someone could pick this book up 50 years from now and wow, these things still pertain, whether it be communication styles and other ways of connecting with people. So thank you. I really appreciate that as well.
Yeah, absolutely. Now, is there anything extra you'd like to share that I didn't touch on?
Well, one of my messages, if I may, and you kind of touched upon it in the very beginning, but I always like to end it with this message with the people out there, and it's back to that hopeful part. Is is like I said, I've dealt with, really, really, really down and out cases, and you can get those loved ones back, and it's never too late to make a change, whether it be on the family side or the someone struggling. I've had people in their 60s finally get sober. I've had people towards some stage of life towards that where they finally make a change. So I never give up hope that change is possible. And we have to be humble enough to say that point where, we need to change what we've been doing. And just, you cannot love someone out of this disease. You could tell them all you want when they're at that level of illness that we love you, we love you, we love you. You cannot love someone out because that manipulation part of the disease that I talk about is what we need to shut down that creates that barrier for someone getting help. And so, but families out there, please, please continue to educate yourself, find ways to be open to direction from people, and just know that change is definitely possible.
Yeah, and I don't just talk to anybody. We're already a small podcast, so it's like if I'm bringing something to you guys as my audience, it's something that I've vetted as it was at least intelligently helpful just to know about. Even if it's not something you can apply to your life, it's good knowledge and it's quality knowledge, stuff that I thought made just good common sense and provided insights to things that people just don't talk about. And it's a lot of times because we don't know. We don't know about some of these topics to the depth that people like Dr. Brian, that's what they do. And that's important to me to kind of spread the message that you're trying to spread here. And this book's out, guys. This is How to Get Your Resisting Loved One into Treatment. It's out
Mhm.
everywhere. Where can we find it?
You can find it on Amazon. That's the best way to get it. It's also available in Kindle form. Um, but yeah, Amazon and Barnes and Noble as well. And there's a variety of other places. And then if you'd like, you can even get an excerpt on it on my website. I don't know if you're going to provide that, but on my website, I do have an excerpt on there and some feedback of people who reviewed my book and reviewers. And so just to get a feel, and it also has links to Barnes and Nobles and Amazon. So that's probably the best way to probably attain it.
Perfect. Yes, all that will be linked below. So if you're linked below, so if you're interested in taking this book up and going on this kind of journey of better understanding addiction as a disease, and hopefully, especially if you're in a crisis situation, this is what this book is kind of geared towards. This is a good resource. I would give it a shot. It doesn't hurt to try it, especially if you need help, right? So
Yeah.
go for it. I do recommend it genuinely, not just saying that. Nobody's paying me today. I actually enjoyed this. So thanks, Dr. Brian. If there's nothing else, we'll wrap it up.
Thank you.
Hey, you. I hope you enjoyed today's episode. Dr. Brian was an awesome guest, and I'm thankful he came on. Leave us some kind of feedback on what you thought about his takes on addiction and mental health below. We'd love to hear kind of your experiences. Our whole shindig is shared experiences, right? But more importantly, I want to know what you thought about the video format. Obviously, I don't have a big fancy podcast studio. I got a brown couch and Echo, and I guess he's enough of a set piece, right? But hopefully you liked it. If you do like the video format, even if it's in its rinky dink state, we'll try to improve upon it in the future. But if you like it, let us know. We'll probably try to do some more of it. But yeah, hope you enjoyed the episode and got a lot out of it. And more importantly, if you want to be a guest on the podcast, or if you know of somebody you would like to be a guest, go to echoesbox.com. We have a contact page and you can fill that out there. I admittedly have one person in there that I need to get back to because I haven't checked it in a bit. But we also have a contact us email. It's on there. All of that information's there. So feel free to reach out and I'll do my best to evaluate and see if you'd be a good fit for the show or not. So yeah, love to hear from you. And again, hope you enjoyed the episode and got something out of it. Peace.